After every lunch, your stomach like a balloon. After dinner, the same. You know this feeling. You buttoned up your clothes when you went to the restaurant and you were unbuttoning them by the exit. No fitted dresses, no tailored shirts, just bloated again. It is precisely this chronic bloating after every meal, which most people consider their own quirk, that in most cases is not a personal physiology, but the consequence of a specific cause. Today, I, as a nutritionist, will explain why the stomach swells specifically after eating, what role protein digestion plays in this, and why bromelain is one of the most well-grounded enzymatic tools for eliminating this cause. Let me start by describing how people with chronic post-meal bloating live and why they so rarely get the right answer. Bloating after every meal is one of the most widespread and least discussed symptoms in nutritional practice. According to surveys, more than 40% of adults regularly experience bloating after meals. Most people adapt. They change their wardrobe, choose restaurants with bathrooms nearby, feel embarrassed wearing certain clothes. It is precisely this adaptation to the symptom, rather than its elimination, that is the main problem. There is an important social aspect of bloating that is rarely talked about. People with chronic bloating often limit their social activity. They avoid restaurants, business lunches, food-centered parties. This is exactly why bloating affects quality of life significantly more broadly than just physical discomfort. There is an interesting clinical observation. In people who systematically experience bloating, anxiety around eating often develops. They begin to fear certain foods, restrict their diet, and eat monotonously. It is precisely the elimination of bloating through the right enzymatic support that often restores dietary variety and reduces food-related anxiety. It is precisely eliminating the symptom that restores freedom in one's relationship with food and with those around them. There is yet another consequence of chronic bloating that is rarely discussed. Constant heaviness and bloating reduce the desire to move after meals. This is exactly what creates a vicious cycle. Little movement after eating, slowed intestinal transit, more fermentation, more bloating. It is precisely a light walk for 15 to 20 minutes after a meal that breaks this vicious cycle and is a free addition to enzymatic support. There are several characteristic stories I hear in consultations. First story, a woman, 38 years old, bloating after every lunch with protein foods, meat, fish, eggs. After a salad, fine. After cottage cheese or chicken, 30 to 40 minutes later, her stomach is like a drum. When assessing her diet and digestion, signs of insufficient gastric secretion and reduced activity of peptic enzymes. It is precisely protein that, when not properly digested in the stomach and upper intestines, reaches the large intestine and is actively fermented there by bacteria with gas production. Second story, a man, 46 years old, bloating after any food, but especially after large meals, works a lot, eats quickly, always on the go. When analyzing his eating habits, meal speed of about 5 minutes for lunch. It is precisely fast eating without normal chewing that creates large food particles that the enzymatic system cannot process fully. It was precisely adding bromelain plus slowing the pace of eating that produced a noticeable result within 3 weeks. This story is instructive from the perspective of combining factors. Bromelain was needed in this case, but without changing the eating pace, it would have produced only a partial effect. It was precisely the behavioral and enzymatic components together that resolved the problem. Third story, a woman, 54 years old. After 50, she noticed that bloating had intensified with the same diet as before. On detailed discussion, age-related decline in digestive enzyme secretion. It is precisely after 50 years of age that gastric acid secretion and digestive enzyme activity naturally decrease. This is exactly why what was digested without problems at age 30 begins to cause discomfort at 50. There is important statistics about this process. According to research, after age 50, hydrochloric acid production decreases by approximately 30% and pancreatic enzyme activity by 20 to 30%. It is precisely these figures that explain why the need for enzymatic support increases with age, even with an unchanged diet. Fourth story. A young man, 26 years old. Bloating appeared after a prolonged course of antibiotics a year ago. It is precisely antibiotic therapy that disrupted the balance of intestinal flora and indirectly reduced the effectiveness of enzymatic digestion. Adding an enzyme supplement in combination with microbiome restoration through probiotics produced significant improvement within 4 weeks. What unites most of these stories? Bloating after meals is not just a physiological quirk. There is important statistics. According to gastroenterologist surveys, post-meal bloating is the second most common digestive complaint after heartburn. At the same time, in most cases, the cause of bloating remains unidentified, precisely because standard diagnostics do not include assessment of digestive enzyme status. This is exactly why many people live for years with a symptom that can be corrected. It is a symptom of incomplete food digestion, primarily of proteins. It is precisely bromelain, a highly active proteolytic enzyme from pineapple that targets this cause directly. There is an important distinction between two types of bloating. Bloating from fermenting carbohydrates, bread, legumes, dairy, usually appears later, 1 to 2 hours after eating. Bloating from undigested protein after 30 to 60 minutes, often with heaviness and the feeling that food is sitting in the stomach. It is precisely the second type that is the primary zone of action for bromelain. There is a diagnostic technique for confirming protein bloating. Remove protein foods from one meal and replace them with a vegetable salad. If bloating after that meal is significantly less, the cause is most likely protein digestion. It is precisely such a simple elimination test that allows confirming the diagnosis before beginning enzymatic support. There is an important fact about papain as an alternative enzyme. Papain from papaya is another plant proteolytic enzyme. It is similar to bromelain in mechanism, but has a slightly different pH optimum. Some nutritionists recommend alternating or combining bromelain and papain. It is precisely such a combination that covers a wider spectrum of protein substrates. Now the mechanisms. I explain as a nutritionist, precisely and to the point. Let me start with the basics. Protein digestion begins in the stomach under the action of pepsin and hydrochloric acid and continues in the small intestine under the action of pancreatic proteases. If at any of these stages protein is not fully digested, undigested fragments enter the large intestine. There, they become a substrate for intestinal bacteria, which break them down through putrefactive fermentation with the release of hydrogen, methane, and hydrogen sulfide. It is precisely this process, fermentation of undigested proteins in the large intestine, that is the main mechanism of protein bloating. There is an important detail about exactly which gases are produced. During putrefactive fermentation of proteins, hydrogen, methane, and hydrogen sulfide are produced. The last has a characteristic unpleasant odor. It is precisely hydrogen sulfide that is the cause of the unpleasant odor of gas during protein bloating. This is exactly why reducing the amount of undigested protein in the large intestine reduces not only the volume of gas, but also its odor. First mechanism, hypochlorhydria and insufficient pepsin digestion. Gastric hydrochloric acid performs two functions. It kills pathogens in food and creates the acidic environment necessary for the activation of pepsinogen into pepsin. With hypochlorhydria, reduced hydrochloric acid production, which occurs in a significant proportion of people over 40 and in everyone taking proton pump inhibitors, protein in the stomach is processed incompletely and partially. It is precisely bromelain that compensates for this deficiency. It is an acid-resistant enzyme and retains activity across a wide pH range, including reduced gastric acidity. Second mechanism, bromelain as a proteolytic enzyme, and the GDU unit of activity. Bromelain is a complex of proteolytic enzymes extracted from pineapple stem. It cleaves peptide bonds in protein molecules, cutting large protein chains into short peptides and amino acids. Bromelain activity is measured in GDU units, gelatin-dissolving units. 1 GDU is the amount of enzyme needed to digest a certain amount of gelatin under standard conditions. At 2,400 GDU per gram, this is a highly active enzyme concentrate. It is precisely the high activity that ensures a significant proteolytic effect even at a relatively small dose. There is an important comparison with pancreatin. Standard pancreatin contains lipase, amylase, and proteases. When bloating is specifically from protein foods, the protease component is most important. Bromelain is a specialized proteolytic agent. It works specifically with protein, without spreading to fats and carbohydrates. It is precisely this specialization that makes it the optimal tool for protein bloating. There is an important detail about the form of pineapple and bromelain. Fresh pineapple contains bromelain in the fruit. However, its concentration in the stem, from which the preparation is obtained, is 10 to 20 times higher than in the fruit pulp. This is exactly why the culinary tradition of many cultures of serving fresh pineapple with meat dishes is biochemically justified. But for therapeutic effect, a concentrated extract from the stem is needed. Third mechanism, bromelain's acid resistance, unlike pancreatic enzymes. Most digestive enzyme preparations contain pancreatic enzymes, pancreatin. They are designed for the intestine and are unstable to gastric acid. This is exactly why they are produced in enteric-coated shells. Bromelain is fundamentally different. It retains 50 to 80% of its activity at gastric pH of 2 to 7. This is exactly why bromelain begins acting already in the stomach, where protein digestion should begin, and not only in the small intestine. Fourth mechanism, bromelain and anti-inflammatory action on the intestinal wall. With chronic incomplete protein digestion, chronic low-intensity inflammation of the intestinal mucosa develops. It is precisely this that increases intestinal permeability and intensifies gas production. Bromelain has its own anti-inflammatory action. It inhibits the synthesis of pro-inflammatory prostaglandins and reduces NF-kappa B activity. This is exactly why bromelain with regular use not only improves digestion but also suppresses mucosal inflammation, eliminating the second component of bloating. Fifth mechanism, gastric emptying rate and motility. Bromelain accelerates protein breakdown in the stomach, which indirectly normalizes gastric emptying. With delayed gastric emptying, a condition accompanied by heaviness after meals and early satiety, fermentation begins in the stomach itself with the participation of bacteria that have entered it. It is precisely the acceleration of proteolysis in the stomach that reduces the time during which undigested food can undergo unwanted fermentation. There is an important detail about motility and intestinal pressure. When gas accumulates, intestinal pressure increases. It is precisely this that is perceived as bloating and discomfort. With normal digestion, significantly less gas is produced and pressure remains within physiological limits. It is precisely reducing the substrate for gas production through bromelain, a direct path to reducing intraluminal pressure. There is an important detail about the use of bromelain in irritable bowel syndrome. In IBS with predominant bloating, enzymatic insufficiency is often a component of the problem. In several small studies, bromelain reduced the severity of IBS symptoms, including bloating and pain. This is exactly why in irritable bowel syndrome with postprandial bloating, bromelain is a reasonable addition to the main strategy. There is an important question about duration of use. Bromelain for digestive purposes can be taken long-term, as needed with food. With hypochlorhydria as a permanent condition, this is chronic replacement therapy. for situational use before large protein meals. It is precisely the flexibility of the regimen that is one of the practical advantages of bromelain as a digestive nutrient. There is one final important safety aspect. Bromelain is well tolerated at recommended doses. Rare side effects, mild diarrhea or nausea, generally occur with excessively high doses or when taken on an empty stomach in people with sensitive stomachs. It is precisely taking it during meals that minimizes the likelihood of these effects. At normal doses and taken with food, bromelain is one of the most safe digestive nutrients. Sixth mechanism, systemic absorption of bromelain. When taken on an empty stomach, up to 40% of bromelain is absorbed into the bloodstream intact. This is a unique property not characteristic of most digestive enzymes. This is exactly why bromelain, taken on an empty stomach between meals, exerts systemic anti-inflammatory and immunomodulatory action. When taken during meals, it locally improves digestion in the gastrointestinal tract. It is precisely this dual application that makes bromelain a versatile nutrient with both enzymatic and systemic action. Now, about mistakes, the most common ones with bloating after meals. Mistake 1. Considering bloating a normal reaction to any food. Moderate gas production after certain foods is normal. Stable abdominal distension after every meal is not. It is precisely this distinction that is key to deciding on examination and correction. A normal digestive process is not accompanied by visually noticeable increase in abdominal size after every lunch. Mistake 2. Eliminating all protein foods when bloating occurs. Protein is an essential nutrient. Eliminating protein for bloating is a tactic that masks the problem instead of solving it. It is precisely correction of digestion through enzymatic support, not protein exclusion, that is the correct nutritional approach. With proper enzymatic support, proteins are absorbed fully and do not cause bloating. Mistake 3. Taking bromelain at the wrong time. When the goal is to improve digestion and reduce bloating, bromelain is taken during meals or immediately before them. When the goal is systemic anti-inflammatory or immunological action on an empty stomach. It is precisely the mixing of these regimens that reduces effectiveness. For combating post-meal bloating, taking it with food is a mandatory condition. Mistake 4. Not accounting for eating habits. Bromelain improves digestion, but does not compensate for eating on the go without chewing. Chewing activates salivary amylases, stimulates gastric juice secretion, and breaks food into fractions accessible to enzymes. It is precisely 15 to 20 chewing movements per bite, no less important a step than enzymatic support. There is important physiology of chewing that few people know about. With slow chewing, more amylase is secreted in saliva, which begins carbohydrate digestion already in the oral cavity. Simultaneously, signals from oral receptors trigger preliminary release of gastric juice and pancreatic enzymes. It is precisely this reflex initiation of digestion through chewing that reduces the load on lower sections and decreases bloating. There is an important detail about time of day and bloating. In many people, post-meal bloating increases toward the evening and reaches its maximum by night. This is explained by gas accumulation throughout the day. This is exactly why bromelain is especially important for daytime protein meals. Precisely the morning and daytime digestive failures accumulate by evening into maximum discomfort. Mistake 5. Ignoring pineapple allergy. The preparation is obtained from pineapple stem. With an allergy to pineapple or other tropical fruits, mango, papaya, kiwi, bromelain may provoke an allergic reaction. This is exactly why, in the presence of food allergy, one should start with a minimal dose and monitor the reaction over the first 2 days. There is an additional group of people for whom bromelain is contraindicated without consulting a doctor. Patients taking anticoagulants or antiplatelet agents, warfarin, aspirin, clopidogrel. Bromelain has a moderate antiplatelet effect and may enhance the action of these medications. This is exactly why with any anticoagulant therapy, consultation with the treating physician is necessary before starting bromelain. There is an important observation about the use of bromelain in athletes. High-protein nutrition combined with intense training is often accompanied by bloating and heaviness, precisely because of the large volume of protein consumed in one meal. It is precisely bromelain that is the first-choice nutrient for athletes with this problem. It targets specifically protein digestion without affecting the absorption of other nutrients. Pregnant and breastfeeding women are advised not to take it. Mistake 6. Expecting immediate results without a systematic approach. Bromelain reduces bloating, but for a lasting result, the combination is important. Enzymatic support plus normalization of gastric acidity if it is reduced, plus microbiome restoration if there is dysbiosis, plus correction of eating pace. It is precisely the comprehensive approach that ensures results that persist even after completing the course. Now, what really works for bloating after every meal? First, determine after which foods bloating is stronger. Protein, meat, fish, eggs, cottage cheese, most likely a deficiency of proteolytic enzymes. Carbohydrates, bread, legumes, cabbage, most likely FODMAP intolerance or dysbiosis. Dairy products, most likely lactose intolerance. It is precisely such a food diary over 3 to 5 days that allows immediately understanding the mechanism and choosing the right tool. There is an important detail about combining bromelain with probiotics. With bloating of mixed origin, both protein and dysbiotic, the combination of bromelain and probiotics works synergistically. It is precisely bromelain that reduces the substrate for unwanted fermentation, while probiotics normalize the intestinal flora composition, reducing gas production from that portion of food that is normally fermented. With predominant protein bloating, bromelain is most relevant. Second, add bromelain during protein meals. More details in the product section. Third, slow down the eating pace. Put down the fork after every bite. Don't eat in front of a computer. It is precisely 40 minutes for lunch instead of 5, not just good manners, but a real anti-bloating intervention. Fourth, check gastric acidity. When hypochlorhydria is suspected, feeling of heaviness after meat, belching of undigested food, nausea from fatty food, feeling of indigestion. 29. Undergo diagnostics with a gastroenterologist. With confirmed hypochlorhydria, bitter herbs or betaine HCl before meals can significantly improve the situation. It is precisely normalization of acidity in combination with bromelain that gives the best result for protein bloating. Fifth, restore the microbiome when necessary. If bloating appeared or worsened after a course of antibiotics, probiotics are the first step. It is precisely dysbiosis after antibiotic therapy that disrupts proper fermentation in the large intestine. The combination of bromelain and probiotics in this variant gives a synergistic effect. Sixth, limit pro-inflammatory foods. Alcohol, excess refined carbohydrates, ultra-processed food create chronic intestinal mucosal inflammation that intensifies bloating. It is precisely reducing the inflammatory load on the mucosa together with the anti-inflammatory action of bromelain that provides a dual effect. Now specifically about bromelain 2400 GDU from pineapple as it relates to post-meal bloating. Composition: bromelain from pineapple 2400 GDU per gram. Hydroxypropyl methylcellulose, plant capsule. It is precisely 2400 GDU per gram that is an indicator of high proteolytic activity. GDU, gelatin dissolving units, is a measurement standard that allows comparing different preparations by their real proteolytic potency. The higher the GDU, the more protein the enzyme can break down per unit of time. This is exactly why, when choosing bromelain, one needs to look at GDU, not just the number of milligrams per capsule. Two preparations of 500 milligrams each may differ significantly in real activity. The plant capsule of HPMC, hydroxypropyl methylcellulose, is vegan and contains no animal gelatin. It is precisely this form that is suitable for people with any dietary restrictions. Three specific mechanisms as they relate to post-meal bloating. First, proteolysis of proteins in the stomach and upper intestines before entry into the large intestine. Breaking down large protein molecules into short peptides and amino acids significantly reduces the amount of substrate for bacterial fermentation. It is precisely this reduction of substrate for bacterial fermentation that is the direct mechanism for decreasing gas production. Second, acid resistance and action already in the stomach. Unlike pancreatic enzymes, bromelain retains activity at low pH and begins protein breakdown already in the stomach. It is precisely this advantage that is especially important with hypochlorhydria, when breakdown in the stomach is most impaired. Third, anti-inflammatory action on the intestinal mucosa. Reducing inflammation in the mucosa decreases intestinal wall hyperreactivity and gas sensitivity. It is precisely with chronic intestinal inflammation that a person more intensely perceives even normal gas volumes. It is precisely reducing inflammation through bromelain that decreases this sensitivity. How to take it? One capsule during each main meal, breakfast, lunch, dinner, or only those meals that contain protein. It is precisely synchronization with food that ensures maximum contact of the enzyme with dietary protein at the right moment. There is an important storage detail. Enzymatic preparations, including bromelain, are sensitive to heat. Storage at temperatures above 25 degrees gradually reduces enzymatic activity. This is exactly why a refrigerator or cool place is the optimal storage condition, even if the instructions allow room temperature. Course, at least 4 to 6 weeks with assessment of dynamics. The link to bromelain in the description of this video. A bloated stomach after every meal should not become a problem. Bloating is not the norm and not fate. It is a signal that digestion is not working fully. 3 concrete steps. Keep a food diary for 3 days. Identify after which foods bloating is stronger. Slow down the eating pace. Chew, don't rush. Add bromelain with every protein meal for enzymatic support of proteolysis directly in the stomach. Good digestion is not a given. It is a skill, and it has nutritional support. There is a final thought about systemicity. Bloating after every meal is a signal that the digestive system is overloaded or under-equipped. It is precisely bromelain that replenishes the enzymatic deficiency. It is precisely the right eating pace that gives the digestive system time to work. It is precisely a healthy microbiome that utilizes what has reached the large intestine undigested. These 3 components together, not each separately, give lasting results. There is a final practical tip. If you want to objectively assess the effect of bromelain, record your baseline bloating level on a scale from 0 to 10 after 3 typical protein lunches before starting. After 3 to 4 weeks of regular use, assess again. It is precisely this simple comparison that allows seeing real progress and making conscious decisions about continuing the course. There is also an important preventive perspective. People who properly support their digestion at 30 to 40 years of age often avoid more serious problems at 50 to 60. It is precisely early enzymatic support, when the decline in gastric secretion is only beginning, that is the most effective investment in digestive health. If this video was helpful, leave a like and subscribe to the channel. Questions about digestion, write in the comments. I read and respond. See you in the next video.